And this is very technical because it's not just, one task that you need to do, because you have to always learn this, relearn this, because you have to follow how they also adapt and improve their systems in the US, right?
Yes, the rules of the game, they're always changing. There'd be new policies or new laws that would be enforced by our client on the client side. I mean, in the countries where we are present in, and we have to always adapt to that. We're always on our toes, actually, in order for us to keep up with the demands and to keep growing as an industry.
Sir, with regards to the number of memberships of the organization, like, are they mostly here in Metro Manila, or are they actually scattered in the Philippines? Like, can you give us a little bit of glimpse of how these members are actually already distributed, so that we can just give a little bit of information of, like, how big is this industry within the Philippines?
Well, primarily the association is based in Manila, but we have member companies who have grown outside NCR. To name a few, we have members who have grown by the thousands in Region 6, in the likes of Iloilo. We have members in Davao. We have members actually who are based in the north, in Cagayan. No? Actually, prior to the HIMSS today, we had 3 pre-HIMSCON sessions in those cities, those areas. We went to Tuguegarao, we also went to Iloilo, and then we went to Davao. And this is the sort of culminating activity for HIMSCON. And it's always well attended, and it gives you not only the size of the industry itself, but more of the interest that's coming into our industry.
Sir, to lighten up a bit, maybe you can talk to us about, what are the so far the achievements of maybe this year, or the milestones for the last 21 years, because I understand that the group has been existing for the last 21 years. Magkaedad lang pala kami nitong group, sir.
All right. The 21 years, because this association started as a small group of companies who are involved in medical transcription, if you've heard of that industry in the past. But with the advent of disruptive technologies, it has reshaped the industry, and it has helped actually somehow expand the coverage, expand the scope of the company. So if you talk about the achievements, well, being here for 21 years is quite a feat already. But having contributed to the growth of the economy of the Philippines, having contributed a lot of jobs to our fellow Filipinos, and having for those who are in the medical field or the allied medical field, having another option for their career. We employ our member companies employ a lot of nurses, licensed nurses in the Philippines, and even NCLEX, US licensed, US RNs. And some of the nurses would really want to be on the bedside, doing what they love in terms of taking care of the patients. But some of them would like to, still take care of the patients, but do away with bedside works. And this is where this industry comes in. Now you can help the patients. You can actually support the patients. You can actually even save lives, for that matter, just by doing the work that you do here in the Philippines. And on top of that, you get to stay with your family. You are in the Philippines. You're earning somehow something that's actually going to be able to support your family without having to go abroad, right? So it's a win-win for those who are here in this industry.
Sir, when talking about the FTEs, or the opportunity for employment or for jobs for the Filipinos who might be listening or watching us as well, do they have to be in the health industry for them to be employed by the companies?
Well, the short answer is not necessarily, because of course being in the medical field is an advantage, or having a background about these things is always an advantage. But part of our initiatives that I mentioned a while ago are trainings, skill up. And as I mentioned, we have defined the skills framework for our industry, and career shifters are always welcome. There'd be opportunities for them to unlearn and relearn perhaps the skills that would be needed. And by the way, the number of graduates versus the foreseen demand for the medical and allied medical graduates, for that matter, there's always lack of talent. There's always room for, more people to come in. And that's why we're very happy about this. And that's why we welcome even the career shifters.
Sir, I'd like to ask if you may answer, you can answer this or you don't have to, but of course, we're coming from the pandemic. I mean, we stepped out of the pandemic already and the world has already opened basically. But how is the organization or even your business probably, have shifted in terms of management, in terms of like, how do you operate now versus how it used to be before pandemic?
Well, being in the outsourcing business for quite some time, we're used to talking to our clients remotely. We are used to working remotely. And that is why during the pandemic, it didn't take us long to adjust to new ways of doing things. Of course, we had to adhere to some security, information security requirements of our clients. But the shift from working in the office to working from home or remotely working came in somehow naturally for us. And for the industry, for the subsector itself on the healthcare information management services, it grew even during the pandemic. Now the pandemic, we're coming back. We're coming out of that phase already. Now we are looking at more adaptability to the changes that's also happening on the side of our clients or end clients for that matter. There are maybe stricter rules perhaps on some of the related to information security still, and we are adapting. The good thing about our industry, our subsector, part of the IT BPM and the IT BPM as a whole is flexible in terms of adapting to what needs to be done. We are providing service, so we're always on the lookout as to what our client would need, what our client would demand. And so, is there anything new? Is there anything specific? Maybe some new initiatives in terms of the capability and the talent, the competencies that would be needed, because we're moving up the value chain. From the set of services that we've been doing in the past, we are now constantly expanding. And that propels new initiatives, new things that we do. But in general, we're always here to give our clients the best service that we could give. So that's where it all starts and where it all ends also.
Wow. We have a very, very interesting discussions already, and there's a lot of information already that we took from you. Sir Vince, thank you so much for your time. Sir, if there's anyone here listening or watching who would like to be part of the organization, would you like to invite them or like maybe lead them to an email or a website where they can, check out so that they can become part of the group as well?
Yeah, so I'd like to invite companies and even individuals who are, into healthcare, who are already maybe serving some clients who are into the healthcare information management services to join us both in HIMSCON and also in HIMAP as an industry association. We are the Healthcare Information Management Association of the Philippines. We'd like to invite everyone to visit our website, www.himap.ph, and get to know more about the things that we do. And we would like to help you and your organization thrive in this ever-changing healthcare ecosystem.
Thank you so much, Sir Vince, for this wonderful conversation. Thank you so much also to those who are able to come here at the event on behalf of the organization and on behalf of those who invited us here as the new channel. Please check them out, himap.ph. Be a member because it's very nice to be in an organization. Sir Vince has told us a lot of the wonderful opportunities and wonderful benefits for you also as an organization. One is to legitimize you, and second, of course, to support you for anything that you want to do in the business and also from the government. So that's very important for us to note, and that's very important for us to also understand. Let's continue to follow them, and please continue to follow the new channel also, because we're always in search for new things, and we're very happy to be here serving you what we do best, which is doing things digital and using digital only for good. This is Apple Manansala from the new channel. See you online. Bye.
Thank you.
Thank you.